Connecticut Spotlight, brought to you by Middlesex Hospital.
Welcome to Connecticut Spotlight. My guest today is Dr. Michael Parker from Middlesex Hospital. Doctor, welcome. Thank you for being here.
Thanks for having me here.
So today we are focusing on colorectal health. What do people need to know about this?
There are three things I think we should talk about today. The first is hemorrhoids, rectal cancer, of course, and fecal incontinence is important.
What do you tell people about hemorrhoids?
First thing I tell them is everyone has hemorrhoids, but not everyone has symptoms. But certainly if they have blood in their stool, it may be hemorrhoids, and we can help them with treatment in the office or in the hospital depending on symptoms.
What is fecal incontinence?
Fecal incontinence is the inability to control a bowel movement. It's something that affects people, sometimes an inadvertent consequence of childbirth, but not necessarily right after, but maybe later in life. And nobody likes to talk about it, but there is help.
What type of help is available?
You can start with medical treatment to control the bowel movement quality. If that doesn't work, there are surgical options that can be very helpful.
Let's move on to colorectal cancer. What do people need to watch out for?
Blood, whether red or black in the stool, needs to be paid attention. Get your screening colonoscopies. Don't wait for pain and vomiting, and make sure that you talk to your doctor.
How can people take care of their colorectal health?
What they need to do is avoid smoking, avoid excessive red meat, and of course make sure that they get their colonoscopy done.
What is involved in a colonoscopy?
Patients get sedation. They're basically asleep but awake enough to breathe. The bowel preparations are much better now, the way to cleanse yourself, much better tolerated, and they don't feel anything. It takes about 20 to 40 minutes on average, and you go home that day.
All right, doctor, some excellent information today. Thank you so much for being here.
Thanks again.
And thank you for watching. We'll see you next time on Connecticut Spotlight.